Hi friends, today it is a very important topic we are going to cover in the history taking, that is history of presenting illness. What is this history of presenting illness? History of presenting illness is nothing but developing the symptoms told by the patient into a nice logical sequence so that it helps you in a direction towards a probable diagnosis even before the examination of the patient. What are the things to be covered under the history of presenting illness? We will see now. The first thing is what preceded the symptoms already told by the patient. You should ask the patient, were you apparently normal before developing the pain in the eyes before 7 months? If the patient says, I was apparently normal, then your next question should be, does it start on its own or there is a preceding event? Now the patient may say, no, there was no preceding event, or sometimes the patient may tell, I was beaten up by some unknown persons 7 months back on this day, following which I developed this pain in my eyes. So in this condition, you have to present like this. The patient was apparently normal 7 months back. On that particular day 7 months back, the patient sustained an injury, following which he developed pain in the eyes. If suppose there was no preceding event, you should say the patient was apparently normal 7 months back, then he developed pain in the eyes without any preceding event. That way you should tell. The next thing to be covered in the history of presenting illness is detailing of the symptoms of the patients. The patient has told you certain problems in him, maybe it is pain in both the eyes. You have to get details about this pain in the eyes, all the details, so that it will help you in arriving at a diagnosis when you complete the examination and history taking. The detailing we will see afterwards. The third important thing is inquiring about associated symptoms. Patient might have told you 1 or 2 symptoms in the complaints, but you know there may be so many symptoms that may be present in the body or that may arise in the eyes. There are certain symptoms that will be associated with the symptoms that will be already told by the patient to you. You should ask, suppose the patient has told you pain in both the eyes, you should ask the patient, do you have any problems in your vision? Do you have any redness in your eyes? Do you have any watering in your eyes? Do you have any discharge in your eyes? Do you have any swelling in your eyes? Like that, you can ask so many things. You can ask about irritation in the eyes. If suppose the patient says, I am having irritation in my eyes also, and all the other things, defective vision and the swelling in the eyes, redness, everything is absent, then this irritation should also be added into the symptoms. So next we are going to the detailing of the symptoms. Detailing should be done for the symptoms already told by the patient in the complaints and also for the positive history in the history of presenting illness. Here already I have told the patient had irritation in the eyes. That is one of the positive histories. All other histories are negative. What are the details to be asked for each symptoms? We will see now. Coming to the detailing of the symptoms. Detailing of the symptoms comes under several headings. The first heading is onset of the symptom. Onset of the symptoms may be of 2 types, insidious onset or sudden onset. We have already told you 2 situations. The patient was apparently normal 7 months back, then he sustained an injury, then he developed pain in the eyes. Whenever a patient has a preceding event before the symptoms, he will exactly know on which day the symptoms started which time of the day it started, then that is called as sudden onset of symptoms. Suppose the patient does not have any preceding events, the patient may tell that it all started 7 months back. I do not know which day or which time it started. He approximately says it is 7 months, it may be 8 months, it may be 6 months. He does not exactly remember when it started. Then that is called as insidious onset of symptoms. Next is the progress of the symptoms. Progress of the symptom, anything which has started either has to slowly increase or slowly decrease, rapidly increase or rapidly decrease, or it has to remain the same, that is static. So a patient may have developed a sudden pain in his eyes, but slowly it has decreased over several days, or it has slowly increased over several days, or rapidly increased within 2 days, and it is present there with such an intensity I am not able to tolerate, or it rapidly decreased with treatment, but still I have some dull type of pain. He may tell like that. So next we go to the present status. The patient has come to you today for consultation. Patient has told you certain symptoms. You have elicited what is the onset, what is the progress. Is it our duty not to ask the patient what is the present status? Yes. You should ask them the pain, is it totally decreased, or it is dull aching, or it is very severe, the patient is not able to tolerate. Like that you have to ask and we have to record it. Suppose the patient says a symptom of decreased vision, you should ask the patient whether now the patient is not having any vision at all, or the vision is good now. Like that you have to ask the patient and record it. Next important thing in the detailing is the diurnal variation. Certain problems may be more during the daytime, certain problems may be more during the night time. For example, cataract, which is developing in the center of the lens, will lead to decreased vision during daytime. Cataract which develops in the periphery of the lens will lead to decreased vision during the night time. So that is one example for diurnal variation. Next is the aggravating and relieving factors. The symptoms may be increased by certain factors. It may be reduced by certain factors. Suppose you are going to have a headache. You are going to a movie which is not at all tolerable. It is a very worst movie, horrible movie, you are not able to tolerate. What will happen? Your headache will aggravate it. Suppose you are having a headache, you are seeing a person who you love much. Once you see that person, because of the comfort caused by the person whom you are meeting, the pain may decrease. This is all about aggravating or relieving factors, and relieving factor may be a drug also for a patient. The next important thing is nature of the symptom. Nature of the symptom. Suppose a patient is having pain in the eyes. The pain may be a pricking type, it may be a dull aching type, it may be a deep-seated type, it may be a throbbing type. Like that, so many types of pains are there. Each pain is characteristic of certain diagnosis. So nature is very, very important. Sometimes a patient may say, I have defective vision. When you ask the patient, you have defective vision for everything what you see in front of you, or defective vision for certain things. Suppose the patient says, my defective vision is on the right side of me. The right sided things are not seen clearly, then it may be a problem in his right eye, or it may be a problem in his left-sided brain. So, nature of the symptom, you should inquire and record it correctly. Next is the referred or radiating problems. Suppose the patient is having pain in the eyes. Sometimes a patient may say the pain is also present in his tooth area, pain is also present in his ear area, because these areas are supplied by the same nerve, that is the trigeminal nerve. It is called as the referred pain, or it may be called as a radiating type of pain. So all these details should be asked both for the symptoms told by the patient and positive symptoms you have elicited in the history of presenting illness. While recording the history of presenting illness, first you should develop the symptoms told by the patient, then you should develop the positive history, and finally you should tell all other symptoms are not present in this patient. Negative history has to be told at the end. With this, we will stop this history of presenting illness today. There are so many details about this history of presenting illness. You have to read in the book and you can gain too much of knowledge about this. Thank you. We will see once again in the next video.